Okay, welcome everybody. Thank you so much for joining us today for our session. We are so excited to get things kicked off. This is the next installment of our Leadership Perspective series, in which we get the opportunity to chat with some visionary leaders in the data analytics industry. And today will be no exception. So before we get that part of the conversation kicked off, I would like to officially thank everybody for joining us today. My name is Kaylee Garrido. I head up events and marketing here at Great Data Minds. A little bit about GDM, if you don't already know us. We have sort of two sides of the house. The first is Great Data Minds Innovation Labs, and that is where we do our projects, our data analytics projects, strategic planning, education, and the deployment of critical data projects. That can be done either in-house in our clients' environments or in our newly launched Innovation Lab environment. So we welcome you to check us out at gdminnovationlabs.com if you're looking for more information on that side of the house. And over here today, we're at greatdataminds.com. And this is where we run our community, our conversation, our great events like we have today. So please feel free to check us out over there. A little bit of housekeeping before we really get things kicked off. This is a webinar. I know everybody is familiar with a Zoom webinar. That means that your cameras and microphones are off, but we do encourage communication and conversation as we go. If you are so inspired to ask a question live, you can either raise your hand or make a note of that in the chat, and I can grant those permissions. If you'd like to engage via the Q&A, you can do that, or just make use of the chat. And Mr. Mike Lamp is already doing a great job of kicking that off. So we love when people are engaging as we discuss there. We'll also save a little bit of time at the end of the session for a more formal Q&A. So if you want to save your question until then, you can do that too. We accept questions in all shapes and forms, as you can see. And so today we are very excited to have with us the one and only Laura Merrick. Laura is the Senior Director of eSolutions at the Medical Home Network. She is an experienced program and product manager with a demonstrated history working in the hospital and healthcare industry. And of course, as always, our interviewer is Mike Lampa. Mike is our very own Chief Analytics Officer here at Great Data Minds. Mike is a true transformation agent. He has been working with enterprises to modernize their analytics programs from the ground up. So thank you both so much for joining us today. We are so excited for this conversation. And Mike, please do take it away.
Well, thank you, Kalia, and good morning to you.
Good morning.
Laura, how are you?
I'm great. Good morning or afternoon, wherever you are.
Yeah, right. Seems like eons since we've talked.
Absolutely. Absolutely. Happy to be here today.
Yeah, well, thank you very much. I'm really, really excited about today's session. So let's just get into it. So Laura, could you just give us a little background on who is Laura Merrick?
Absolutely, Mike. So I do have a bit of a non-traditional pathway that's led me to healthcare technology and care delivery. And, over 20 years ago, I finished college in 3 years with a Bachelor of Fine Arts in dance and started my career as a professional dancer. And my dance background taught me about hard work, dedication, discipline, perseverance, creativity, and of course, passion. It's hard to be committed to something without passion. And while my professional dance journey was over 20 years ago, I really started training seriously when I was 15. Mm-hmm. So lastly, I think the one thing that has really led me to where I am today that came from my dance background was the importance of community. Mm-hmm. There's so much collaboration and teamwork required to pull off a performance. And so all of those things I talked about, sort of dedication, discipline, all of those things have stayed with me and represented who I am today in my professional career. Now, sort of leading a lot of care delivery transformation through technology and data interoperability. Just a quick story, or as I might sort of say in my old hat, a leap across the stage, or the risk that I took to change my career was, sort of what kind of made that building block happen was I was dancing for a company and we oftentimes would experience, a lack of funding. And my whole goal and my passion was dancing and performing. So that meant that, Mike, we had to be extremely creative. And in that creativity and in my goal to dance, and we had no money, literally getting laid off, but I was still employed. It's a very strange experience dancing, but I had the opportunity to create a program called Moving Connections. Which was essentially a way that we could get funding to help us perform, but it was designed to help increase mobility and activity levels of senior citizens. And it really took us inside of the bricks and mortar of the nursing homes and hospitals. And doing that work allowed me, achieve my goals, which is I wanted to get back to dancing on the stage, but it opened up this door for an experience that really making a difference and an impact with patients that was happening in care facilities, really is the piece that made me ultimately take that leap and that risk to change my career.
Yeah, you took your purpose and your drive for purpose.
Right.
Yeah. Yeah. It's interesting. I was an aspiring musician for many years, and we were never funded either. And we started a movement. We put a tip cup on stage.
Yeah.
Didn't work so well, but oh, that's awesome. I love that background and that backdrop. So could you share a little bit with us about the Medical Home Network?
Right. So Medical Home Network, it's a nonprofit collaborative that has fundamentally changed how care is delivered. So we take a proven model of care that unifies provider and their communities, and in these diverse healthcare entities around a common goal to redesign healthcare delivery and transform the way that care is managed and practiced. And that work, kind of tying back to that sense of community, really has to start with providers and patients, working together to improve health, and engaging with various care teams to develop relationships with patients that really extend beyond the four walls of a primary care practice. And so the work that we're doing is providing the tools and the process to help care teams engage patients and help them become accountable members of that team and engaging to improve health status. And sort of research shows that patients who are involved in making their healthcare decisions tend to be healthier and have better outcomes. So kind of around the work specifically that we're doing, it's not just, the pillar of, or a building block around, healthcare or technology and data. It really begins with, governance and engagement with providers, model of care, workforce development, and then of course technology, data, value-based incentives. And I think the success of Medical Home Network over the years has really not just been one of those things, but it is the what I'll call the building blocks and how we weave those together in the aggregate to really drive system transformation, how they collaboratively work together. Just very quickly, I was a third hire of this organization, and that was nearly 12 years ago. This mission that we have in terms of changing care, really started grassroots on the south and southwest side of Chicago, and now the work that we were doing is meant to be national and really expanding outside of where we started. So it's pretty kind of cool story that I have been able to follow the journey and the growth of an organization that started as this provider collaborative. Literally, I mean, I was there back in the day when we were knocking on the doors and pulling in CEOs and saying, please just check your institutional identity at the door, sit around this table, collaborate, all of our same patients. We have to work together. So there's a lot of stories I have around where we began and where we are today, which is pretty phenomenal. So
yeah, gosh, I remember when we first started working. It's been 2 years, a little bit over 2 years now. I remember, and during that time frame, both Julie Barrows, my business partner, and I were going through, the elderly parents that were in assisted living and all the nuances that come around there, and they get shipped to the ER, and then they come back to the assisted living facility. Meds were never shared or exchanged. The whole medical cocktail got changed, and they would bounce, and it was horrible. And I remember so vividly how the goosebumps I got when I really understood the purpose you were driving on behalf of the Medical Home Network. I was like, man, we want to get behind this thing, because this is going to change. This is going to change healthcare for the better for the people that really are disenfranchised.
Yeah,
to a great degree.
I mean, I think you hit it right on there, which, when we started the work with Great Data Minds, just sort of the project kind of, I had to reflect on what is the problem. So if I can for a second, just sort of narrow in on what that problem looked like when I started, and how it continued to evolve with the work that we're doing, particularly with Great Data Minds, is, I remember in the early days at Medical Home Network, I had to have, these providers would have this firsthand experience where on a daily basis, these patients were coming to them. And when I first started the work, these clinics were not on electronic medical records. So I'm saying records are on pen and paper and record and file. And so you can imagine, like today, I'm sitting here talking to you about this interoperability. What does that mean? Now I'm able to use fancy words now, but back then it really was, if a patient ended up in the emergency department, how was their assigned primary care physician to understand? How were they communicating in a timely manner to make an impact? So I think what kind of led the work, particularly with where I am extremely passionate about, and where kind of you came in, was, listen, we knew we had this large mountain to climb to solve a problem, and that a total transformation needed to happen. And we needed to be able to really think about right data, right time, right place, and really understand not the technology problems that I needed to solve. I mean, certainly technology, is not the barrier, but what were the providers' experience about that, that we needed to address, and really allowing the work to be led from those physicians trying to get this information in a promptly manner. So, and kind of it's these real world experiences, around the provider experience that I think brings the innovation to life. What you just shared with me, Mike, about, following the caregiving experience, because you are a part of the care team, trying to figure out what's going on with your family. I mean, that's real world experiences that are bringing that innovation to life. And so over the years, Medical Home Network has responded to many of these problems, and, on connectivity and care management, and really focused on enabling providers to really, kind of go back to practicing outside of the walls in the community. And so those are the experiences that continue to matter to MHN. And when we started to engage with you was at the point, that pivot period, where we decided to stop just chipping at the edges and really solve a fundamental problem. That vision became reimagining the provider experience, and trying to tackle a little bit more than we had been used to. And the strategy that I remember you bringing forward to me was, hey, you've got these great ideas, let's start simple. And I said, yes. And thus the MVP was born. So I sort of feel like that was kind of the journey where you kind of came along and helped us really understand to apply these strategies to solve the right problem, that allowed us that gave us the flexibility to adjust our foundation as we went through the process. So
yeah, gosh, I remember that so much. And I remember us talking too. It was like, okay, we're building a product here, and we're going to incrementally build out upon it. What a great journey it has been. Oh my goodness. So,
Yeah.
so help me understand, help the audience understand a little bit some of the fundamental componentry or building blocks behind this interoperability product.
Yeah, so I think the best way to start is really understand the entirety of the ecosystem. So we work with a lot of federally qualified health centers, and they, as well as large hospital systems, and they are all on, disparate electronic medical record systems. And in order to, empower our care model, we do take in disparate sources of data that shape the 360-degree view of the patient. So this is information that really is occurring outside of what they know about in their practice. So how do I understand the patient's journey across the healthcare ecosystem, so that when I am engaging with that patient, I am able to understand at the point of care how best I can connect and engage, whether it's a social determinant of health or a medical issue, to really understand what's happening with the patient. There's a lot of information, and we wanted to focus on an experience where we could get the data organized in a snapshot, and then made sure that it was delivered to the provider within their native system, which is the EMR. So understanding that we've got, everybody on different system, that's reality. And we have a lot of data and we want to organize it, because I think the experience is often we're dealing with providers who, when they're in their EMRs, they're siphoning through information, trying to find something. They have 15 minutes with the patient. They don't know what's happening over here. They don't have time to look for it. And it was important for us to create this way to view information. And so we created what we call the patient baseball card. So it's the MHN baseball card, where we put together all of that disparate information. We also apply analytics to that information, so that that 360 view is viewed with a snapshot, and it's dynamic and it's accessible within to the most relevant information accessible in their systems. So that's a little bit about what the information is. The critical factor of that information, we do have a care management platform where within the MHN model of care, which is decentralized. And what that means is we believe that the care is best delivered at the practice site. So we're not employing care teams, we're engaging with the care teams at the practice site and enabling them through technology to deliver the care at the practice. That way they can build those relationships with the patients that are, and that's really, really kind of what that means. So all the care is delivered at the practice site, and that baseball card and all of the activities that they're doing around care management is serviced by clinical RNs, so licensed, but also some unlicensed community health workers, as well as, care coordinators. And they're using our platform to really understand how to prioritize their risk and engage with the members. So that's within their systems. But the layer and the reality is the record of care for the providers is that electronic medical record. And so while we were solving connectivity and care management, there are these other issues, which is, data wasn't necessarily getting to the doctor or the physician that had that time. And we wanted to make sure that we were fully providing that information in the EMR to support those communication, that conversation between a care team and a provider naturally and synergistically through the data and through the technology within the EMR.
And I recall too, a key objective they had, back on the technology side for just a second, a key objective and core foundational principle that you told us we had to adopt as part of this interoperability product was adopting the FATH Health Information Resources Standard, or FHIR.
FHIR, correct.
Yeah.
FATH Healthcare Interoperability Resources. Right?
Yeah, and At that time, talk to us a little bit about how we chose the enabling platform.
Yeah, so a couple of things that were important to MHN were sort of what are our core technology, capability goals was, remember I said I wanted to deliver this to different entities, different systems, and really think about how do I enable that provider experience. So I wanted to lead with that and scale this. We really wanted to reach all providers and make it accessible to everybody, regardless of their information technology capabilities, their resources. I know a lot of these clinics don't have IT staff, don't have those data resources. So it's really important that we did something that was really simple and seamless to them. So technology goals that were important to MHN in doing this were, API-led connectivity. We wanted to open the door to connect to all the disparate systems and multiple data sources. We also, you brought up those FHIR standards. We wanted to be able to convert ourselves to these open standards to be more flexible and functional. And the FHIR standard sort of, brings healthcare interoperability to the present, and really kind of allowed us to be, more flexible with the standards, and also continue to adhere to some standards that were that CMS had established in terms of how we can share information. So this common language was important for us to help bring our providers along wherever they were. The other thing that was important was a multi-cloud environment, serverless infrastructure. We wanted the right cloud for the right application. And we wanted to take, we wanted to go and take advantage of the strengths of every cloud, while reducing our server footprint. And I think the other thing that I will say come with healthcare is that we wanted to increase our cybersecurity posture and implement industry best practices. We really sort of we had all these things in mind in doing this. And so I think when we got to the point of really understanding what those goals were, and we partnered with great data minds to really allow us to go on that journey and to guide us through that journey. And so I think the technology, what we landed on, and I'll tell the FHIR story, is really kind of interesting of what of the reality of what really happened. But at any rate, when kind of going to the API and the infrastructure where we ended up sort of building, we ended up going with Google and leveraging their healthcare APIs for a number of reasons. One, we needed to move fast, and we wanted to be able to achieve our goals. Listen, I was leading with that experience. I was leading with technology components. I wanted to set the right foundation. And in order to do that, I needed something that was ready to give us the insights that we needed and the visibility into what was happening. And that's kind of what we got right away from Google. Those APIs were designed to do what we needed to do right now. And so we took advantage and jumped into that.
Yep. And I do remember, let's talk a little bit about your notion on the reality as it's set in. I remember us marching along, and we got to that end point, and then what happened?
Yeah.
Right?
So ends up that while the industry is advancing in ways that I'm extremely passionate about and excited about to drive the sort of FHIR standards in that exchange, that is really kind of around a lot of the outbound data to make sure it's accessible. So coming out of a system, we can drive, a FHIR objects or components that allow us to access that information in a more timely manner, much like HL7, but kind of the next level, right? Out of the system. I wanted to push data into the system, not so that I could disrupt these workflows, but that so, again, we're adding value on top of information that is not otherwise available in the EMR. Ends up, most of the EMRs today can't accept the FHIR objects coming into the system in the way that we were trying to organize it. So we pivoted, but in a great way. the way that we pivoted is we started to, first we made sure that we're converting all of our data. We built the Firestore, and we continue to maintain that, follow the standards, and increase that. The way that we're delivering the data, though, in the endpoints in the current work is not through Fire, but through these open APIs where we can deliver the data how the provider and how the EMR can consume it. So our pivot was, I think that we had this vision, but we learned more and more about where everybody was at. It was, and that meant that we needed to have creativity, going back to my roots, around, well, we're going to deliver this, and this is certainly absolutely, possible. So we maintain the flexibility of the functional standards. We do convert all the data all of the time to that, and we have that Firestore available, but that's not where everybody is right now. And so we didn't let that stop us, and we found a way to work with all these disparate systems and different mechanisms. So that endpoint delivery is unique to where that EMR is and on what version they are, because not one system is the same system. So even if it's the same vendor. So
Yep. Yeah, and I do remember the manifestation of that creativity. I mean, we still delivered things through an API-based endpoint.
yeah.
But the thing we delivered was not updating data elements in an EMR.
Right. And I think that one of the things I want to emphasize in the journey of interoperability, that I think, Great Data Minds and the partnership that we had with MHN and Google was emphasizing that, this truly is a journey, and while there's going to be an end to the project and I'm going to go live and all this is happening, there's really not a start and end on the journey, meaning that, this wasn't what I learned very quickly to kind of elevate the work we were doing, was this is not a race that begins one day and ends another day, but it's rather a continuous cycle of improvement. And we've been able to evolve over time. And that's really kind of the MHN way, where we have been able to, since going live, we started with one, we were successful, we scaled, we're now live with 13 organizations, disparate systems, and we're actually scaling to our other markets, this work. But I think, this continuous evolvement has continued to happen even from the start, where we're adding more data, we're continuing to align with, am I pushing, am I pulling, how is it happening? So it's constantly evolving, so I think, collectively, I'm always about, better provider experiences, improve patient outcomes. And so collectively, I think the focus for MHN, for our providers, for all of the technology that we've used, the way that we've brought everybody along is we're all collectively reaching that North Star. And so I think that has really driven results very quickly and improved how we advance care delivery. So, yeah.
And then going back to on top of the creativity, you talked about community, and I remember the incredible amount of time you and your team put in making sure that the care providers were very, very actively engaged, because that was going to be the key to adoption. Right. Because in the healthcare industry, I mean, categorically, healthcare industry is in its nascent stages of really adopting technology. And my sense is, from some of my experiences before working with MHN, is there's not a lot of trust in the digital data, categorically this is. And some of the early attempts was having the care provider interacting with the laptop instead of interacting with the patient in front of them.
And I think, I'm glad that you brought the community aspect up, because I think that's what has really been a very, very big part about our ability to kind of go back to the mission, which is really building healthier communities, the providers and the patient relationships, and being able to see the information are in a timely manner, enable that, right? And so we didn't want to lose sight of just delivering information that was just going to fall into, information overload or disrupting. We really were about transforming. And in order to do that, we led with, when I say lead with the provider experience, I mean, what I'm really saying is, like, what's the workflow? How are you going to click this button and win? And really understanding when a provider is inside the EMR and looking at all of this information, what do they need to know right now? And how can they get to that without, so that's the kind of thing I was talking about, is that we really brought them along. They were a part of the process to make sure that it was adopted. And I think they really appreciated that voice, because we were focused on right information to the right place at the right time. And that really drove a really strong adoption, that they were a part of what this needed to be to service their ability to engage patients. So.
And this end-to-end interoperability, is it novel? Or was it at least novel when we first were able to implement it?
Yeah, I mean, I think, a lot of times, interoperability means different things to different people, right? And I actually try to, when I'm working with providers, I don't even use the word interoperability. It's about, what is your problem that I need to solve? And the problem that we were solving was, I don't have access to this information in the place that I need it. That's what was. So being able to scale that, I think, was really exciting, because everybody benefited. It didn't matter if they were on whatever version of an EMR, or maybe not as sophisticated as a large hospital system. Everybody was really going to benefit. So I think that was kind of the piece that was very, very powerful, and continued to open up other doors. We talk a lot of data, but we need the data to be, one of the things that I think also was important around the baseball card was, this was actionable and readable. And so it wasn't about, this wasn't targeting somebody who needed to understand how to look at the data. They needed to understand how to care for the patient at that time. And so that was about, like, we needed them to know that their patient, has been in the hospital, 15 different times across 3 weeks, across 10 different hospitals. Like, I'm making this up, but when I'm saying that, or who to talk to, it was about, I would say, the three things that this, did was, it opened up the continual door, which we've been working on in a different way, to connect, communicate, and collaborate. So,
Yeah.
That
story, and I really do love the whole baseball card concept. I mean, it's a snapshot of critical statistics right now,
right? Yeah,
and point you to the action, right, that needs to be taken. I just love that,
right.
So that's a pretty healthy journey you've been on. So what keeps you up at night?
No, I would say it's that's a good one. What does keep my kids? Things that I would say, the things out of my control. I focus on the work. I love what I'm doing. MHN's doing great things, and that's extremely energizing. And there are things that we are doing that are out of my control as well. And so I think, if I think about what that is, was the adoption strong enough? I reach everybody the way we needed to? Am I making an impact? I can't control a lot of things that happen, and things break, but I would say that's what keeps me out of the night. The things out of my control. Don't they all? I mean, it could be a million things, but but I would say that that's constantly top of mind. Just really making sure that we're, doing everything we can.
Yeah.
And, I think ensuring adoption for technology, brings equity. Not everybody has the opportunity to experience technology how I do every day. For providers and patients alike. So kind of understanding that.
Yeah, well, even in the data analytics industry, we do a lot of continual digestion of research that comes out, and staggering numbers that are out there is like less than 21% of data products and analytic products that are delivered to the community are ever even adopted. They're just sitting there dormant, right? And it's unnerving as a practitioner. You're worrying about that last mile. How do I make sure that last mile really happens? And so you have a young family. You got a passion. I said you have a young family. You have a passion for dance. You stay up late at night wondering about the last mile. How do you keep the balance?
Focus on the work. I think it goes back to kind of the roots I was talking about in the beginning. I was able to really find, the things that, if I go back to the beginning where I started, if you were here in the beginning, was, that dance background, hard work, dedication, discipline, perseverance, creativity, and passion. I mean, that's my mantra. I am not going to stay at somewhere as long as I have, unless I'm passionate about it. And I think, MHN is doing great work, and it's truly energizing. Sure, trust me, I have had many lessons learned. It has been a journey of, ups and downs, as it is with any industry, any work. But I think I love the work. It's hard to let that go when we're continuing to actually make an impact. And I think one of the things that's great about MHN is I see the impact. I am close to the impact. I am understanding the impact. I am getting it. And I'm taking what I'm learning from those experiences and putting that back into what more can we be doing around data exchange and integration. That's led to, I think just kind of a little bit more about sort of the way MHN has been operating in our growth is, we've been for 2 years in a row, voted best places to work. I've been taken care of. It's a phenomenal organization. Really, while we're focused on our communities and serving and improving our communities, they're also focused on in improving our abilities to experience the things that I'm sharing with you today, and the opportunities to innovate, fail fast, and get back up. I certainly, learned all those lessons dancing. You just get right back up.
Mm-hmm. Yeah, well, you definitely, you embody, your entire team embodies a lot of the core principles of a lean approach to building product. Yeah.
On the baseball card product, one of the things that's really been exciting is I would say we did, there was an article around the work we did in EHR Intelligence. So you should check it out. I think it's also on our website. And then I have a fearless leader. Our CEO, has also through Health Leaders had a lot of different interviews on the work that we're doing. Because while this is just one piece of a project, there's many more things that we're doing across the industry to service patients in a more organized way. With the baseball card, I was just recently learned we did receive a digital health award. So for our ability to reach different providers with this sort of integrated, model to collectively serve several different clinically integrated networks. So.
Yeah, kind of, I'm thinking two things: testimony to the open, the quest for being open, and leveraging the open standards so that we can very quickly flex. And then you mentioned scale several times, right? You recently, you mentioned also we started out with a network that was supporting South Chicago, Southwest Chicago area, right? Since then, tell us a little bit, have you expanded out to other parts of the country?
Yes, absolutely. So we are now servicing the state of Ohio, the state of Missouri, and we are also now moving into Oklahoma, California. We've done work in North Carolina and Indiana, Michigan. I'm like, you caught me. I was like, wait, going. It's pretty significant. Our service, again, is really around empowering the care model, the model of care, with the technology enablement to service Medicare and Medicaid recipients at these various primary care practice facilities and associations. So, been pretty phenomenal to be able to take our proven value and model and replicate that for others that really need it. So,
leveraging cloud, we are so fully passionate about this. Please stop trying to provision on-premise applications, right? But that comes with, it's very easy to migrate to cloud. I'm going to say that. It's very easy to start leveraging cloud services and getting value out of them. But there's a need to keep a watchful eye on the performance of the platform as using a leading indicator if you see a spike in your cloud costs.
Right. Yeah. So I'm glad you brought that up. When we started, I really didn't know a ton, and what we were able to do is very quickly talk about pivoting how you're doing things. We actually were able to work with the technical teams, Great Data Minds, to make sure we were using first of all, we were leveraging BigQuery to understand what was happening and the volume we were generating and how that was flowing, and really customize the ability to see that activity. And then where we saw, then we were able to partner to see opportunities to improve, how we were managing or leaving the lights on and when we were or when we weren't. And I think, to be honest with you, we pivoted how we were processing and flowing information, because we have large data in our warehouse kind of connecting to this system. Mike, I mean, don't quote me, but I think we're down to like $100 a month. So we've continued to, that's been something that's been really powerful, is to have the tools to see and actually make a change and prepare for scale and replicating this cost nationally, which is what our passion is. So
I was quite surprised when we monitor your costs. I was like, oh my gosh, do you know how much this is costing you a day?
Exactly.
It's like $3. It's awesome. We do have one question. I know myself, I'm not going to be able to answer because I haven't played with technology yet, but Rod Jones, who is a dear friend of mine, and he's in this space very deeply as well, and very passionate man when it comes to improving healthcare through analytics and proper use of data. His question is, what's your opinion on the approach to use blockchain to solve interoperability?
Ooh, that's a good one. First, I will caveat, I think you said Rod. Hi, Rod. I am not the expert on blockchain, rather more around seeing the big picture of how these healthcare organizations, take the key challenges of interoperability based on maturity levels when it comes to their data and their governance and use of the standards. So I think with blockchain, I think the breakdown, first, I haven't really heard of too many. I think there's a lot of down that path. I think the sensitivity that I hear in the industry and the work that I'm doing is it's not easily adopted because there's different transactional approvals and different people and different users. That my understanding, at least my minimal understanding about it, is that while it does address current challenges on syncing and understanding patient data sort of multiples and these different pieces to kind of link all these things together, I think the framework in terms of managing the identity across the ecosystem is hard to get sort of adopted. So it's going to break down these barriers, but how is it that we can implement it for the EHRs so that that is a part of their kind of, you know, content approach? So I don't know that the adoption has been wide. However, I will say I've been following it. I think the technology continues to evolve, and I think it has an opportunity for long-term impact in healthcare if we can figure out some solutions to really reach the market and to reach, take those capabilities to enhance, you know, data sharing, and, you know, while also kind of thinking through privacy and security. So
Right.
I certainly think that what I would love is greater adoption, but I think it's really figuring out how can we get patients, you know, fully in control of their health records. So to me, it's really getting from, you know, I've talked a lot about provider to provider, and I think this is really becomes provider to patient or patient to patient, peer to peer, to really embrace their own records. So I think there's a space for it, and I think it certainly has evolved.
Mhm.
Rod,
Awesome.
that's, I don't know if that gives you a good answer, but that's the way I think about it.
Well, I'm thinking I'm going to have to connect you and Rada.
Okay.
Two colleagues with same level of tenacity and passion. Yeah, definitely.
Nice.
Thank you, Rada. So, Laura, if you were to give us some parting thoughts, you know, closing items, calls to action, what would that might be?
You know, I mean, I think I've talked a lot about this sense of community and sort of that brings, you know, how do we bring, you know, equity into the way that we look at innovation and technology? And I think sort of my sort of guiding principle or thoughts, you know, is that, you know, I can have the greatest technology idea, but, you know, going back to the root of, you know, just understand the problem you're solving, start small and prove that value, bring along those that need to engage as part of the process. You know, I feel like we've been really able to, in particularly in my career, been able to be a part of care delivery transformation. And I acknowledge that that is not just about technology. That really requires, you know, the partnerships. It requires that we're thinking through, you know, not just that one building block, but all of the building blocks and how they work together. And that's really what is driving the system transformation in healthcare. I sometimes wish our industry was further along, but it's very, very rewarding to see the changes that we've had in the partnerships that we've been able to forge to really accelerate development and to accelerate adoption of those things. So a long way of saying just, you know, keep it going, keep trying. You know,
keep the eye on the prize. Eh?
Yeah. I think community collaboration, top of mind for me, and you know, I'm passionate about what I do. So
yeah.
Yeah.
Well, if I may, you know, on behalf of everyone at Great Data Minds that has worked with you, you are an incredible servant leader. You are so inspiring, and you're an amazing partner. The way we have worked together over the past 2 years, I'm so very grateful and honored that we got to work together and that we met as people. And I want to see you dance someday.
Oh, okay. A while, but no, thank you for the opportunity. It's been a phenomenal partnership, and I can't wait to do more and learn more from everybody here today. So thank you so much. Appreciate it.
Thank you so much. Beautiful.
This is awesome. Thank you so much, Laura. So appreciate your time today. I'm taking it that you have a mantra. I didn't know that. That's amazing. Do you feel that that's a helpful thing that you can kind of go back on when you need to be reminded about what your core values are?
Oh yeah, knock your socks off every day.
Love it.
Socks off every day. Yeah.
Love it. Awesome. Well, this is great.
Yeah. Thank you so much. I appreciate it. Bye, Kayla. Bye, Great Data Minds. Thank you.
Bye.
Bye-bye.
Thank you so much, everybody. Have a great day.
Bye-bye.